Hey everyone, this is our case study on Adam. So like we said, our client was Adam and he was assessed at the age of 2 and his diagnosis is autism spectrum disorder. The intervention approach used throughout his treatment history is pivotal response treatment, also known as PRT, and his preferred activities include Disney and Sesame Street books and movies and puzzles. So for medical and developmental background, there were no birth or no complications during his birth, and his mom had a healthy pregnancy. He met his early motor milestones at an appropriate and early age, and these included sitting up, crawling, and first steps. And he sat up at 4 months, crawled at 6 months, and had his first steps at 11 months. He was known to be a fussy baby, and he was difficult to soothe at times, and he displays intense focus on items, specifically with his ceiling fan at home. He has a fixation with that, and he could be non-compliant at times, and he regularly displays meltdowns when engaging in simple tasks, and he is noted as a serious child who often smiles infrequently. For communication baseline, no expressive verbal communication. Word attempts he uses on a regular basis, and he displays 10 to 30-minute frequent tantrums when he is denied access to something he wants to do or something he wants. He engages in restricted repetitive behaviors 70% of the time when he's not engaged in an activity, and those can include watching television or eating. So for his strengths, he could problem solve when he wants an out of reach item that he needs somebody to get for him, something or somebody to get it for him. He's able to put toys together when they are broken. He displays preferences for specific people, including his parents, and he enjoys physical activities such as swinging, roughhousing, and being thrown in the air specifically by his father. The case study talks about 3 past interventions that he goes through: preschool, preschool, and elementary. And so for preschool, they use the feedback model, and that provided parents with opportunities to carry over speech intervention strategies they model, and it provided feedback relating to their implementation, and it focused on strength-based and child-led intervention techniques. They helped him request items through labels, and that introduced verbal word approximation to Adam, and he learns that using verbal communication becomes a positive outcome. His acquisition of first words were slow, but within 2 months, he had gained a total of 70 words. Then they did recasting longer utterances. So for 2-word utterances, for example, Adam would say up, and the clinician would prompt up high. And for 3-word, Adam could say more chips, and the clinician would prompt more chips, please. And so the intervention team recommended 2 things for when Adam went to preschool, and those goals were focused around social goals and communication goals.
And then for his preschool intervention, they implemented a priming strategy for multiple occasions. One was for circle time to reduce challenging behaviors such as tantrums, and also increase task engagement. And then they also used it for transitions, to give him a 5-minute warning before the end of an activity, and then give him 1-minute warnings after that, to make sure that he had adequate time to move on and clean up. And then for class modifications, they did some simplifying tasks to increase engagement at a language appropriate level. And they also teach the phrase, I don't understand, if something is too complicated, in order to demonstrate that he needs clarification. And then lastly, for turn taking, they use this to enhance social interaction and social communication. And they targeted this first with adults, and then afterwards they moved on to peers.
So for his elementary school, we had improvements in his communication skills, his socialization skills, his academics, and his behaviors. He was having paraprofessional support, but it started to fade in 5th and 6th grade, and they would only go help during outdoor socialization. Adam reported bullying in his after-school program, so experienced staff did observe the situation. And they found that the bullying did continue once Adam asked the students to stop or when he became visibly upset. So the experienced staff is teaching Adam not to react in these situations. Providers are helping Adam improve on his conversation skills with his peers. He is still reliant on his parents to provide additional support with schoolwork, and they worked on inappropriate behaviors with Adam, such as his pica tendencies, where he was eating paper, small rocks, and dirt, etc. Adam is making consistent progress with his program, his family support, and his IEP goals. And to accomplish the pica tendencies, they did use a self-management system.
So for the intervention approach, the clinician chose PRT. And some of the foundational principles of PRT is that we want to capitalize on child motivation. And in order to do this, we focus on their preferred activities and sort of infuse them into treatment. And then also the second principle is to use naturalistic therapy in order to target them in a more generalized setting based on environment and whatever treatment strategies they choose to use. So for the strategies used for Adam specifically, they use child choice by including preferred activities and conducting a preference assessment. They also used a variety of modeling and prompting in order to promote success. And they also did a gradual progression in order to meet goals. So for example, starting with single words and then prompting for 2-word utterances, first using familiar vocabulary, and then eventually using more non-familiar vocabulary. And then after that, they moved on to recasting longer utterances and would have Adam repeat back the longer phrase to make sure that he understood what the correct response would be. And so for the current intervention in high school, his goals are targeting the domain of cognitive aspects of communication. And so for the first set of skills are about executive function. So like forgetting books and assignments at home and lack of organization and planning for schoolwork. For attention, they focused on the fact that he might not pay attention during class, which also might contribute to the fact that he doesn't know what assignments to do or how to complete them. And then lastly, in the area of problem solving, they talked about not asking, that he doesn't ask questions to authority, such as teachers, to clarify expectations. So overall, the goal for high school was to increase self-management and independence. And so for the current intervention strategies, obviously self-management is a PRT pivotal area. So that's why this was chosen for high school. And the strategies that were used were selecting a designated support person that would help assess his understanding of assignments, advocate for him, and monitor schoolwork completion. Priming was also used at this stage to let parents know that to let him know that his parents will no longer help him with remembering assignments or completing them. He also got a peer's number that he can reach out to for support after school hours. And they introduced a planner that he can refer to frequently. They also used all of these different strategies to target one class at a time. And once he made adequate progress, they would move on to the next class. And so problem solving is something that can be targeted also more directly in SLP sessions that wouldn't necessarily be implemented by his support person. And so for these therapy activities, there's a few considerations that we want to keep in mind. One is obviously to incorporate his preferred activities, either within therapy or as rewards. Also, we could do peer-mediated activities throughout the lifespan. So at a younger age, it can be used to prompt one-word utterances, for requesting items from peers. And currently, it can be used for schoolwork to promote collaboration after school hours if he needs additional assistance. Priming is also something that's been used throughout his therapy, and it can be used to promote success and set clear expectations. And the last consideration is a peer buddy system that can further improve his social skills in preparation for college, because in college they are expecting socialization to be one of his primary struggles. And so for the activity, we would use a self-management and visual aid for problem solving. And the visual aid would include steps to initiate and ask clarifying questions to people of authority. You would start in a structured setting such as SLP sessions and then transition to classroom use. The self-management worksheet would also be used for him to document progress himself and keep himself accountable. So this is an example of something that we would use, and it goes over the different stages of how he would be able to ask clarifying questions. First, he would ask, do I think I can do this on my own? And if not, he would ask the teacher about what he doesn't understand, and then he would repeat it back to the teacher to make sure that he fully understands it before he leaves the room. And then these boxes at the bottom are for him to self-document when he is using the strategies and when he's not using the strategies, so that he can also increase awareness of what's expected of him.
So these are resources, and it's just a bunch of like, what is autism? I'm going to show you the Autism Guide for Teenagers, which is just for someone who is in late high school and they're moving on to adult life. And so these would just be steps that they could follow. And this is our handout. It just gives a breakdown of our presentation, like his medical background, his baseline, his intervention approach, his recommended therapy activities, and the resources. And these are our references. Thank you.